Days after calling off the doctor strike that had been scheduled to begin early this week, the Kenyan Medical Practitioners, Pharmacists and Dentists Union have once again put the government on notice, calling for their demands to be met. Speaking at a meeting to discuss the welfare of Kenyan healthcare workers during this COVID-19 period, KMPDU Secretary General Chibanzi Mwachonda reiterated that doctors will mobilize a strike should the government fail to meet their demands.
And if we engage to address the issues comprehensively, then that shall avert the intended and the planned strike action.
Sentiments that were echoed by LSK Chair Nelson Havi and Mwachonda are pushing for all health workers in all hospitals to be taken care of by the government as far as fighting COVID-19 is concerned.
If you don't negotiate effectively and get a binding contract for your benefit now and forever, then the government will always subject you to litigation where they have an upper hand.
Dr. Brian Gishinga, Chairman Rural Private Hospitals Association, said all doctors face the same risk in fighting COVID-19.
The safety of our healthcare workers, the rights of our healthcare workers to health at the forefront. Whether they are in public sector, whether they are in private sector, Kenya does not have enough healthcare workers to lose them on the pandemic.
Council of Governors Chairman Wycliffe Oparanya on his part urged healthcare workers to call off their strike and give room for negotiations in order to get a lasting solution to their grievances.
Na sisi tunapambana nao tuone ya kwamba wakifanya kazi wana vifaa ambazo zinatakikana, lakini kufika saa hii watu waende mkomo na tunataka tupigane na ugonjwa, itafanya watu wetu wakufe kwa wingi.
KOTU Secretary General Francis Atuoli said most of the medics lack insurance cover and he cannot keep silent while they suffer.
And the spokesperson of workers on the continent of Africa, I took initiative to meet those who matter in the system, in the government of President Uhuru Kenyatta on issues concerning our doctors, nurses, and the entire medical fraternity.
This comes even as Kenya recorded 14 deaths in the last 24 hours. 673 people tested positive for the virus, bringing the total number of positive cases to 90,978.